Jamila Henderson. I'm a research analyst at the Metropolitan Area Planning Council, or MAPC, and I'll be talking about using indicators to drive community change. So this presentation will serve as a primer for using indicators to drive community change. For those of you familiar with indicators, this will be more of a review, but we thought it would be good for at least one of us to kind of give the basics on what an indicator is, especially for those who are less familiar with indicators. And I would put myself in that category maybe a year ago, so this was kind of new to me as well. To better understand what an indicator is, I'll highlight the work around MAPC's Regional Indicators Project. And following my presentation, we'll hear Charlotte Kahn, Senior Director of the Boston Indicators Project at the Boston Foundation, and Jim Farnam, Principal of Farnam Associates, discuss the extensive history that they have using indicators to track progress in Boston and in New Haven, respectively. So let me just start by giving a bit of background. The work that we do at MAPC is guided by Metro Future, which is the regional plan for Greater Boston from now through 2030 to improve access to transportation, increase affordable housing, preserve natural resources, and make the region a more equitable one overall. And it's this equity component, I think, that drives a lot of us in the room, because it's clear that inequities still exist. If you were here for Mark Drazen's presentation on the state of equity of Metro Boston this morning, he really underscored that point. The State of Equity in Metro Boston report is the first in a series of indicators reports under the Regional Indicators Project that will monitor the region's progress towards achieving goals set out by the Metro Future Plan. And it's a plan in which thousands of people convene to discuss their vision for the region. And some examples of the equity-related goals of Metro Future are displayed here. A wider diversity of housing types are built in all communities, helping to combat segregation based on race, ethnicity, and income. Health outcomes improve for residents of historically disadvantaged communities with increased access to healthy food, green space, better air quality, and medical care. This is just an example of some of the goals that have come out of Metro Future. So before we really jump into the Regional Indicators Project and talk about it in depth, it's important that we all have a general understanding of what an indicator is. An indicator allows us to assess progress, and it's necessary to make periodic quantitative assessments of conditions. A regional indicator should include information at a variety of levels, providing an understanding of conditions in the region generally, as well as a comparison of conditions across and within cities and towns by race and ethnicity, and by income and education. A regional average or a median can often mask what's actually happening within groups or across groups, and so it's important that we break down these indicators to those finer levels. It's also important to note that indicators differ from context-setting variables, which are elements that generally can't change or that are difficult to change, such as a person's race or ethnicity, for example, or interest rates monitored by the Fed. Those are things that are really out of our control. The real difference between indicators and context-setting variables is that we have more control over indicators, and we would expect to see change over time given specific interventions or policies. And with context-setting variables, that's not really the case. So how do you develop an indicator? It's not always clear which indicators to use when starting a project. Just kind of some basic things here, like conducting a literature review to get an idea of what others have used is a good first step. You may also need to test the indicator to be sure it really measures what you're looking for, as well as cross-reference the indicator and other research to see how it was used. A larger endeavor would involve piloting the indicator by collecting information and evaluating whether the results reflect your needs. And another really important point is to get stakeholder input in order to get an informed view of how the community would like to track change. So good indicators have the following qualities. They're relevant to the subject of interest. They're available. It's not a proprietary data set where there's confidential information. They're collected regularly. They're interpretable. People can understand them. They're cost effective, and they're sensitive to change, because though there may be small changes, there's still changes all the same, and we'll want to be able to capture that. Many of the indicators that we use at MAPC measure our progress towards smart growth principles, those which encompass compact, walkable, and bikeable urban areas with a range of housing choices, attributes which ultimately lead to a more sustainable region because it reduces transportation costs, preserves natural resources, uses space more efficiently, and promotes a sense of community. So this brings us to our Regional Indicators Project at MAPC. The recently released State of Equity Report and website, this is the website here, is our first product to come out of the Regional Indicators Project, and it serves as a baseline for where the region is now, allowing us to track our progress through future indicator reports. By illuminating key needs, this indicators report will also inform policy recommendations to make a more equitable region. These policy recommendations will feed into a policy report, which will build on the Metro Future recommendations for change, providing advocates and policymakers with a set of tools that will enable them to work to build a region that benefits all residents. So I apologize, there's kind of a lot going on this slide, but I'll try to unpack it a bit. So we looked at Metro Future, which is our shared vision for the region, to help shape the Regional Indicators Project. We needed clear goals to help guide this process. There are 65 goals outlined in Metro Future, which are supported by a set of more specific and largely numeric objectives. And as many objectives as possible are tied to indicators, which are regularly collected data points that form the basis of the Regional Indicators Project. So here we see an example of how the goals, objectives, and indicators relate. So, for example, Metro Future Goal 14 reads, an increasing share of the housing in each municipality will be affordable to working class families and fixed income seniors. And we have a number of objectives tied to that goal. One example is rental housing units costing less than 30% of regional median income will comprise a growing share of the region's housing stock. So we're looking to make housing more affordable. And the indicator that we could look at is the percent of income that households spend on housing costs by looking at cost burden. How many households are cost burdened because they're paying more than 30% of their income on housing? And of course, this is something that we'd like to track over time and hopefully see declines in that indicator. So there are many indicators to choose from for an indicators report, but we highlighted equity goals first. Because meeting them is crucial to achieving the vibrant vision and region envisioned in Metro Future. The indicators spanned a number of different data sets, ranging from the census, the American Community Survey, the Department of Elementary and Secondary Education, HUD, Mass GIS, the Department of Health, and many others. These data sets were used because they reflected our indicators of interest. They were accessible, and for the most part, they were up to date. And here's just a list of some of the indicators that we included in our report, but there's many, many others that aren't listed here. So there were a number of indicators that we could not use in the report, however, either because they were unavailable, costly, outdated, or they weren't available at the geographic level of interest. There are several data sets, about 10 to be exact. I think one we've almost secured, number 7, but about 10 that we haven't managed to get our hands on, and they're listed here. So there's always more data to be had. The State of Equity report is relevant because it was released in the midst of the Occupy protests, which criticize the increasing income inequality in this country, a theme that's weaved throughout the State of Equity report. The report is also accessible to all. It's available online, and it's easily interpretable because it reads more like a story than a traditional indicators report. Unlike many other indicators reports, it uses a life stages framework, explaining how inequities affect individuals at each life stage. So children, infants and children, teens and young adults, adults and older adults. And it really chronicles the story of how equity affects individuals throughout their lives. This approach differs from that of some of the more traditional indicators reports, which often only present data points by topic area and may not necessarily tell a story. To sum things up, there are a few things that we should keep in mind when using indicators to track change. It's important to conduct research, of course, to ensure that the indicator measures what you want it to. It should be available and collected regularly, and it should be easily interpretable. It also needs to be sensitive to change, but most importantly, there should be a number of goals and objectives guiding the process, particularly those formed through a community visioning process, similar to the one used for Metro Future. So we can do our part to develop the best indicators to help us track change and bring about a more equitable region. However, there's still much more to be done at higher levels. To improve data collection for indicators research, we have to democratize information. And I've listed the steps out here. I'll explain that a bit more. Metro Boston needs greater capacity to use data and information in decision-making at the local, regional, and state level. The first step is to align data collection and research to support key policy issues. Ensuring access to and the utility of data will require a strong information infrastructure, both technical and institutional, and the widespread application of advanced tools to support citizen and business engagement. Metro Boston is well positioned to pilot a new approach to regional data collection. Local, regional, and state actors can act now to share data sources and services to create flexibility, save money, enhance access, and foster collaboration across state agencies and the public. Thanks. And I guess I'll turn it over to Charlotte. Kahn? Yeah, I'll get it over to you. Oh, that's mine. There we go. Great. Okay. Just click.
Great, thank you. Well, hello again. I started working on indicators in 1997, and I thought I would just share with you, which was really the beginning of our indicators project at the Boston Foundation in partnership with the City of Boston's Sustainable Boston initiative at the time. And so I've been sort of doing this now for a while, and I was thinking, what have I learned that might be of interest to others? So I'm just going to, in the interest of time, move through this rather quickly, and then we hopefully will have time to talk later. So just a quick overview. I think a lot of you know what the Boston Indicators Project is, but perhaps not. So it is a partnership still with the City of Boston, and now for a long time also with the Metropolitan Area Planning Council, as you can see at this event. Our goals are to democratize access to data and information, foster informed public discourse, and track progress on shared civic goals. We have a long time frame. The year 2030, which is Boston's 400th anniversary, is sort of our end date. We did that partly just to try to transcend, turf wars and political timelines and that kind of thing, to really try to focus on the big picture. What kind of place do we want to create together, and how do we know whether we're making progress? We have two tracks, what we call the data track, and that's a lot of what we're doing here today, and the civic agenda track, which is, okay, that's what the data show, now how do we really turn that into change? Part of the both really is putting out a kind of provocative biennial report. Our last one, and we feel kind of prescient about this, was on income inequality in 2009, and that's really, as others have said, has gained steam as an issue. And our next one is going to be on jobs and the economy. It's coming out in a month and a half. Has a lot of provocative data. And we also do occasional short reports. This is an education report card, and we did one on poverty that we released this fall that made the front page of the Boston Globe. Just reminded people that, you know, we're outperforming the nation and many other states, but really when you look at Boston, we have a lot of poverty and a lot of challenges. So what are the lessons learned? I think I won't read them here because I'm going to walk us through them one at a time. So the first one is that good data and indicators by themselves are really not sufficient. I learned this the hard way. You know, that there's a long journey between getting the data that you think you need and having an impact with it. And that data can, the journey can travel through creating the indicators, setting goals, milestones, you know, constructing these reports, even that get good coverage, turning the data into strategies and agenda, getting alignment on resources, really driving toward action, and finally impact. Now, sometimes that can happen quickly, but very often, unfortunately, it can take, as you know, a generation. So in my experience, a lot of important things took 20 years. I see people nodding. The Southwest Corridor, remember that? I don't know how many people do, but you know, the highway was stopped in 1968. The park, the linear park right over here, was opened in 1988. You know, that's kind of seems to be the rhythm of real and lasting change and big projects. So don't be discouraged, just get started because it might be a long haul. Another thing that I've learned is what I call both and is usually much better than either or when you're looking at indicators and using data. That by not having arguments about whether you're going to get the, you know, or is it going to be neighborhood level micro data, or is it going to be, you know, municipal level? Is it going to be, are you going to convene community stakeholders or policymakers? Generally speaking, in the indicators world, it's always both. You want as much as you can get. You want a broad range of opinion. You want to really give yourself the flexibility and scope to go deep and wide at the same time. So these are the 10 sectors in which we track change. And we've got, you know, really comprehensive indicators for each one of those. And they tend to go from the regional down to the neighborhood level, if possible. And we also try to get some data about sort of fiscal issues and costs and that kind of thing. So, you know, it took us 2 years to come up with this framework of meeting with hundreds of people. And this is it turns out somebody told us, you know, that only a project in Thailand was as comprehensive as ours at one point. And it's because it came up through the community. We were one of the first places that had arts and culture in our framework. Now many places do, but that's because people said, you know, that's really important. We have something called civic vitality, a whole sector that includes race relations, social capital, philanthropy, access to information, all of these important things, civic glue kinds of things that are not a formal sector. It's not like transportation or public health. That came up through those conversations, and we had to construct a sector in a sense and then get data to support all of those things. So it's also, our framework is also what we call asset-oriented. In other words, we don't say within public health, we don't say child health. We say healthy children. And then what are the measures that would tell us whether our children are healthy? So it's not that we don't measure the same things that we might if we were measuring child health. We still have low birth weight, immunization, access to coverage, standard measures, but it's within an aspirational framework because people really want to paint a better picture of their communities, not track deficits. And so, we have measures like a well-prepared workforce, a clean air, not just air quality. So I think personally that that's important because when you add up if you look at all of the things we measure, it's a description of where we all want to live. However, we also, and this gets at the both and kind of thing, we also have what we call a cross-cut filter, cross-cutting categories. Like, what if you just wanted to see all the data that we collect at the neighborhood level, you can just pull that out on our website. Likewise, children and youth. So you don't have to choose, are we going to measure children and youth as a topic, as a sector? No, we don't have to because children and youth come into play in transportation and environment and education and public health. So you can look at, in a sense, you create a whole new set of indicators by just pulling out what's covered across the other 10. Likewise, with sort of regional competitiveness, fiscal health, sustainable development, you can imagine that pulls from housing and public health and environment, and transportation. And then race and ethnicity, where we can really look at racial ethnic disparities very specifically, or not just disparities, strengths. But, in other words, you can almost look at these as separate sets of indicators, but it's a cross-cut kind of systemic way of looking at the other sectors. And very often it's, real solutions are in the interstices, even between the big cross-cutting topics. Let me just say, for example, equity issues that you just heard about in the Metropolitan Area Planning Council's Equity Index, would be a sort of a cross-section of, for example, sustainability, race, ethnicity. And we reserve the right to think big in terms of our both and. It's not just, neighborhood level data. We're living through one of the most volatile decades in human history, technologically, environmentally, demographically, and economically. We need to be aware of the big picture because a lot of the things that are buffeting us, even at the neighborhood level, even on a block, are actually the result of big global forces. And that, as Derek Jackson mentioned, climate change is one of the things that can affect us all intimately, and yet if we're not looking at the big picture, we could just be unaware of where some of these big things are happening. Likewise, economic globalization. We'll look a little later at some of the economic data, but we have to be, Mark said it, we have to look at these data in a nested way, and we have to reserve the right to go all the way up to global if we want. Then another thing that I've learned is that behind data snapshots lie very important trends, comparisons, and disparities. In other words, often when people do an indicators project or a report card, you're looking at a kind of simplified set of measures. You have to know what's behind those. It's fine to do simple, but you better understand what got rolled up into that measure if you really want to have a deep understanding of what's happened. And you have to be able to explain it to others as well. So, for example, on the left, the headline is Massachusetts is #1 on the NAEP, the nation's report card, right? NAEP. And that's true, we are #1 on the left. However, in the chart on the right, when you break it out by race and ethnicity, white and Asian students, actually Asian students are at the very top, whites are at the next, and then Massachusetts is right under that, and then it says Minnesota. So white and Asian students in Massachusetts are at the top. I mean, maybe this would break out if we did it like that for other states too. But look at Black and Latino students in Massachusetts. They rank with Alabama and Louisiana. So the idea that we're #1, it's just not good enough. plus, and we're not showing that, number one is 49%. You know, where is that at? If we really looked at a global comparison, we would see that that's not adequate. So we have two problems: global competitiveness or global comparisons and racial disparities. So the real gap is not, you know, and actually people on a different test in math, the US ranked 17th and everybody was really upset about it. But when you looked at the national data, you saw the same breakout by race and ethnicity. So our Asian students actually did just as well as the top achieving students in Shanghai. Black and Latino students were 40th and 46th, something like that, globally. So the real gap was not what was in the headlines, US low. The real gap was within our own borders. And so if you can't disaggregate the data, you don't actually know what's going on. And so to then use indicators without understanding what they unpack into is to really mislead people, as you heard. It's easy to mislead with data, maybe especially positive data. So for example, third grade reading proficiency is something that you all probably know is an incredibly important indicator because it measures prior preparedness, early childhood, the quality of early education, all of these things, and it's a predictor of future academic success. So we've been tracking that for a while, and we've gone from, hardly it moved at all really, from 01 through 2011, we've gone from, 32% proficient to 37% proficient in the Boston Public Schools. But what you're looking at here is a chart of every single school that has a third grade in Boston. Turns out that the range is between 10% proficient and 70. So you've got to know what you're really looking at in order to understand your indicator. It's fine to use the 37% to show that we really haven't changed overall, but know what's underneath that. And then we can also, on top of this, look at percent African American, percent white. Who's in these high and low performing schools? Whoops. And then we need to understand, the ones that have a high percentage of Black and Latino students that are high performing, what are they doing? So here's another headline. BPS, the achievement gap in terms of passing 10th grade English Language Arts, MCAS, has almost closed. That's great news, and it really is. But when we look at that same measure by proficiency, not just passing, we haven't made as much progress as we have to. And here, I know these are heartbreaking statistics, but they are, and we have to change. So we need to understand where we really are. So we say, we have one of the highest educated workforces in the nation. That is true. But now look at statistics by adults over the age of 25 over time. This is 1990 through 2008. And, Asians and whites, again, have made great progress in terms of percent with a college of BA or higher. But we haven't seen the same progress for African Americans and Latinos. And here, behind that, we see college graduation rates for the top 10 institutions attended by BPS graduates in 2009. You can see that the graduation rates range from 6% at Roxbury Community College to 80% at BU. Now, historically, always four-year colleges have a higher completion rate for all sorts of reasons. Community colleges are just, working adults are just who are often students at community colleges just have different challenges or different even goals often. But still, we need to understand what's behind some of these statistics. Likewise, this shows in Boston, where we have such a highly educated workforce, and that's true, we still have a great many adults who don't even have a high school diploma, and they are geographically concentrated. Likewise, same kind of the mirror image. This is a chart by census tract of Greater Boston. You can see Boston outlined, and you can see the swath of Boston, which is really Roxbury, Dorchester, Mattapan, where adults do not have a college degree. And here we see percent white, which is the dark blue, Greater Boston, you can see that same swath. So again, you know, we all know that we are challenged here still to achieve racial equity. And as we've heard about the region, now we're looking more deeply into Boston. And this is some, you know, these are sort of the stats behind the headlines. I'm gonna be quick. This is just job growth. Yes, we're doing better than the nation as a whole, but again, people on the right with a bachelor's degree or higher are at almost full employment compared to those with less than high school on the left. So, you know, there are great disparities behind the headlines, behind the snapshots, behind the top level statistics, and we just need to be aware of those. So then finally, what I've learned is that a commitment to constructive community change combined with analytical skills, data visualization tools, and good data is incredibly powerful, but it's not rocket science. You know, this is something that's accessible, and you're going to see a tool later today, the Metro Boston Data Common, built on the Weave platform, that I hope every single person in this room learns how to use, and use well to drive change. You can do it. So we still have big challenges. This is, you know, quickly, this is some of the same stuff you just saw, Boston by percent African American, and here we have housing foreclosures. You can see how incredibly focused the predatory lending and aggressive marketing was in Boston and how destructive it was. This is another challenge. I'm so glad, Pam, you're here. This is our spending in the state on health care, but it's driving out our spending on the actual determinants of health, like education, public health, higher education, and environment and recreation. It's crazy. We're not going to get healthy by spending more and more and more on health care. And we have real challenges. Even though we're spending so much, and our healthcare costs are among the highest in the world, we still have rising rates of hypertension and obesity in the state and the city, with, again, concentrations in low-income communities of color. So that is a disconnect that we really have to address, because that's where the money is. Someone asked Mark Drayson, what did he think the biggest challenge was? Well, I think the biggest challenge is shifting that equation so that all the money isn't tied up in healthcare, so that we can do something about these other things like housing and education, because we're not going to make progress if we don't. So, you know, there are vehicles. This is something called Healthy People, Healthy Economy. On our website, we have an emerging civic agenda with very specific goals. We can do this. This is a bent curve. It's an example of child lead poisoning in Boston, reduced by 90% when people got together and really decided to change. So there's nothing that we can't do when we work together. Thank you. And don't forget to try out Weave later.
I just have to load my presentation or something. Is that okay? Where's the little cursor? Here it is. Hold on a second. Well, here, we're getting the cursor back. having a file conversion issue here. So I think that we have the wrong file type, I guess. So I could just play it, yeah, I'll just play it offline. Sorry for the delay.
Sure, we'll put it up on our Boston Indicators Project website, or are we going to have all these presentations?
Yep, we will. Either on the Boston Indicators Project website or on metrobostondatacommon.org. We'll have everything from today. The webcast, all the presentations, posters. Yep.
Any other comments, questions? Well, the one that I showed you was labor market participation. It showed both unemployment, formal unemployment, and also percent out of the labor market. I didn't go into that, but that means both discouraged workers and people voluntarily out of the labor market. So for those, you can see the differential. But, you know, so for people with a BA or higher, formal unemployment was something like 4.9%, which is almost full employment. We have an economist here, so he'll correct me from the BRA, John Avalt, if I'm wrong. And then there was 9% out of the labor market. You kind of imagine, you know, people, mothers staying at home and this and that. It's sort of probably more voluntary. And then you see those without high school. And I think it was 15% or so formal unemployment. No. It's a total 30% out of the labor market entirely. And many of those people are young people. So that is a terrible statistic. And we actually have another slide in our upcoming report. It's in our poverty report, which you can see on our website right now, which I really do encourage you to go look at. Black teenagers are by far doing worse than anybody in this labor market. Yes, the statistic that I'm talking about, thank you, that is different. Yes, in our upcoming study, which we're going to come out with in about a month, on jobs in the economy, we do have what's called malemployment or involuntary part-time work, that kind of thing. So yes, we do have some of those statistics as well. We don't have a release date yet, but it should be certainly by mid-March. I mean, it's going to the printer sort of next week. So, and we'll have it up on our website. I'm just not exactly sure. But you know, the Boston Redevelopment Authority has a lot of really great data. John, do you want to just talk about what's available now? Do you guys have malemployment for Boston residents as well as unemployment?
No. Right now, for more fine-grained look like that, we have to look to the state level. The American Community Survey, which offers a lot of detailed questions, unfortunately, for some of the most detailed questions, requires that we look at either 3-year or 5-year combined data. So it's much less interesting to see what things were like over, say, a 3-year average, rather than at some particular point in time. Because most of us are interested not just in what are things like, but how have they changed. So I think that for your question on underemployment, where we look for workers who are involuntarily working part-time when they would like to have full-time work, really the surveys that we use to determine that don't help us much if we try to look below the state level.
We are going to have some good tables in our next report that break out jobs by sector, and then within or within an occupation, and then within sub-occupations, and then by race, ethnicity, and weekly wage. Again, trying to show people how to get underneath some of these kind of headline indicators. So, you know, we can show that within one occupation, there might be a certain number of people making, you know, $120,000, and then a whole lot more people making maybe 40 or 30 or something like that. And so Department of Labor statistics data are really good. But you know what, we're going to hear more about some of these tools and how you'll be able to use them later in the day. And eventually, we're going to have all this data up there for you. And you can go in there and try to, you know, make maps and charts and things yourself. So,
Can I just add quickly, I'm not sure about the capacity of this workshop, but there is in the afternoon use and misuse of labor data. So if you've signed up for that, that might be really interesting.
good.
Okay, great. And if not, you know, the PowerPoint and some material should be available on the Metro Boston Data Common website following
And
the event.
it's so important to really look at economic data right now. I mean, that's another, I could have made that one of my lessons. You know, it's not something that was really on my screen, but given what's going on now with the economy, we really have to understand that and break it out and become very facile with using economic data. So I'm really glad that you are asking these questions.
Sorry for the delay on the technology front. My name is Jim Farnam of Farnam Associates. I've been working with community indicator data for many years on many projects, and now I'm helping with Charlotte to drive forward the Open Indicators Consortium. You'll be hearing more about that at 1:30, and you've heard about that with the Weave software development across a 15-member now collaborative, national collaborative. And also what I'm talking about today is our experience at Connecticut Data Collaborative, which is a relatively new, it's a couple of years old, effort, a public-private partnership in Connecticut to make data more accessible and help people to use it from a variety of sources, including the federal sources, but also all the state administrative agency data that we can get our hands on. And just a quick note, this is the Weave tool, a screenshot of the Weave tool mapping for Connecticut, the wealth rank for education funding purposes. You can see the progression as you get further away from New York, or say closer to Boston. The wealth goes down, as higher wealth is darker. And then over there is a correlation between the wealth rank and the adult drug arrest rates. This is part of a drug prevention portal we've been building with our, which you'll hear a word about in a minute. So what one of our main projects, we do a lot of work on advocacy for better data, open data on the state level. We do on standards for data and data use. We're trying to set an example in our work. Our main project that we're building is ctdata.org, which is a data access site through this public-private partnership, which will have a knowledge center to document the data, including a metadata database. Everything about the data will be documented and with room for commenting and how are people using the data and the uses and misuses, you know, indicator by indicator. And then we have this data common concept similar to the Metro Boston Data Common, where we're developing these customized portals within that by sector and geography. So over the 2 years we've been reaching out to all the different constituencies in Connecticut, and we've already have 4 topical portals, sub-portals within the site. And if you go to CT Data, there's a portal tab. You can go to these individual ones as a similar look and feel of different color schemes, but for each one, we sort of filter the master data set down into like what's relevant to that group and work with that group to customize what the views are, customize the visualizations, as well as what's available for them. And you can always go to the main portal and see all of it, but then this sort of narrows it down. And then we have regional communities, and we are ending up with the 3 main cities of Connecticut. We'll have regional groups working with us to say what data do they need, working with community groups, working with regional, local collaboratives, regional collaboratives as well. And this is just an example of building state agency relationships. I'm not going to go through the detail, but it's basically we're because it's a small state, we're the size of like a county in California at 3.5 million people. We are linking, and we between the steering committee members that formed this, it was formed after 20 years of frustration with dealing with state agencies on data, that we just said, look, we're just going to whip this and go out there, build these relationships, and get the data out there in ways that we would have wanted to use it all these years. So this, just have a couple of examples to run through the equipping community collaboratives, public agencies, and nonprofits with data and the tools to use the data and the training to use the data. So we have early childhood collaboratives, these regional action councils for prevention of substance abuse, a word about DataHaven and our work locally. I had founded DataHaven about 8 years ago, the DataHaven iteration. It's a 20-year project, but then Mark Abraham, who met before, is the current executive director there. So for the early childhood collaboratives, these are a couple of examples of some of the data we provide access to. They are in 55 communities with foundation funding from Grouse Center Memorial Fund. They're building comprehensive local early childhood service systems, similar to a lot of the work going on in Massachusetts, I'm sure. And there is grounded in a data-driven framework of results-based accountability, or RBA, so developed by Mark Friedman. The Annie Casey Foundation supported a lot of the early startup work on that. And that's really linking the results you want to the indicators to measure those results, and then using that to drive community conversations, drive community planning. It's been a very powerful tool. It's getting a little bit cultish for those of you who are in this work. It's like some people are feeling like it's almost like getting to be a religion. But to me, as a planner, an urban planner for many years, it is like just a framework to communicate. It's a common sense framework of how do you link data to results, to strategies. We're also helping them address data challenges, like some very small numbers. You must face this here too when you have like either low birth or very low birth, or teen pregnancy, or teen births to 15 to 17-year-olds, or some of that is zeroed in. You really can't look at 1 year of data for a small town, because it's just like the rates go up and down dramatically because one incident is so dramatic. So we understand that, and then do 3-year averages, 5-year rolling averages, which we don't have on the website yet, unfortunately, but that's what we are working on to make those smaller numbers useful. That's an example of sort of addressing some of these challenges of interpretation and use. And then we're using that, helping them use that data across sites, across the communities, to inform the Early Childhood Alliance for the advocacy at the legislative level in Connecticut, which is always necessary. The Regional Action Councils, just briefly, these are set up under federal law. There's state epidemiology and outcomes work groups. There's one in Rhode Island. There's probably one, I think there's one in Massachusetts. We have one, they're federally funded. They came to us, and they've been putting out all these reams of data on miscellaneous spreadsheets in various formats from 10 different federal state agencies and some federal data. And the local collaboratives just said, how do we use this? We have to go through 10 spreadsheets to aggregate a time series. So we took all that, made a partnership with them. They gave us a little bit of money. Now you can look at time series, you can slice and dice it, and do comparison geographies online using the Weave tools and the data selector tools. And they're using that to do their community needs assessments. And then we meet with the coordinators of those regional councils to train them and help them and answer questions about the data. So they're really trying to drive that into specific interventions and regional plans to fight substance abuse, which is probably as much and more of an issue. It's as much of an issue in the upper income and rural communities in Connecticut as it is in the urban areas. DataHaven, there's a Health Matters collaborative that DataHaven's been supporting, and really bringing the data down to the neighborhood and street level has been very important in terms of looking at foreclosures, health outcomes, crime analysis, working closely with neighborhood groups. We have 13 management teams advising the police department that have sort of grown into sort of community boards that they work with to survey the neighborhood and also to present this data work on solutions. So that's bringing it down to that level, as Mark had suggested in the other talk, is important. That's not on the website yet, but that is a facility within Weave, within our plans, is to, now we have mostly town level data. We're going to bring it down to census tract data. We already have downloaded all the community survey data, and we're developing, for instance, in the city of Bridgeport, we're working with a local health survey they did to break it down to the neighborhood level in terms of citizen behavior, citizen attitudes. And then processing that survey data into indicators is a challenge. So we have the technical assistance to work with the community coalition in Bridgeport to say, with the health department, say, what meaning can you draw out of these survey responses and turn them into indicators that can then drive action at the neighborhood level. And at DataHaven, we have a regional survey project, but every hospital is required now under IRS regs, if you can believe it. So the IRS is driving data collection now. You have to do a community survey something wrapped up with proving your nonprofit status. I don't know the details, the legal details, but every hospital is doing a community needs assessment now. So we're trying to get them together in our region and say, let's, instead of everyone going off and collecting all their own data, let's work together to develop a data set and interpret that data set together with the community to come up with these hospital needs assessments to present to IRS. And I hope they're using them for their internal planning as well. So, just a few themes in closing, sort of from our work in this. I think we found a lot of the interest we have is building these cross-sector connections. So in one place, we are working with the housing sector, in community development, health, education, early childhood. So a lot of the data sets are overlapping. Everyone's using the data sets around basic demographics and economics. So in one place they can get it, then they can use that and cross-tab it with their sector-specific data more easily, and also look at relationships in the health equity area, especially between housing and education, as Charlotte was saying, showing some of her slides. And I think the importance of easy access to quality data and tools, and sharing that infrastructure cost. So all those portal partners, we call them, they're all kicking a little bit of money so that between us, we can do it once and do it right and do it better than each of us trying to fight through the getting the data and cleaning it and supporting it and making it accessible. And then learning data use, as Mark Abraham pointed out, it's like access is not sufficient. We are doing this extensive RBA training process for the early childhood collaborators, and we're building stronger community skills in using the data, in injecting it into their campaigns, injecting it into their plans through these different processes I mentioned. And we're also always working to build stronger connections to planning, policy, and action through this. The Connecticut legislature has adopted results-based accountability as their framework for budget deliberation. So we're going to be working with them for all the different departmental programs coming in. We'll link it back to the data we have online and then present it in powerful ways so that it can be injected into the debates at the state level, at the legislative budget level. And that's basically what I had to say. So I guess we'll open it up to further questions to any of us, or get into if there are any questions that you're facing in your work that you want to bring up and we can help you on, or people could talk about. That's also good.
Hi, I'm Mike Lane, I'm volunteer dating. I noticed on your picture of alcohol-related accidents,
Yes.
looked like your map of alcohol-related accidents looked like it correlated to your economic.
This map is wealth rank.
Okay.
Wealth rank. This is alcohol-related accidents. I'm sorry, alcohol drug arrest rate. Maybe it was the other slide you were talking about. I'll bring that back up.
Okay, I thought this was wealth rank versus the other one. They look similar, and I guess the question is, and it ties into, I couldn't read it very well, but it looked like the indicator was the number of accidents.
Yeah, this is a rate.
Year.
Yeah, this is in this case, it's the rate of accidents, the blue being the lowest rate, so it's accidents per, I think, population in this case.
Oh, it is probably, because that was my question, was whether it was population-based. Okay.
So here you have the histogram that shows the distribution of the groupings, and the blue is the lowest, and there's no really strong pattern here. I mean, these sort of middle rural towns have a little higher rate than the wealthier towns. There is, and that's this tool we could bring up and do a crosstab with
Okay.
economic factors.
This is for you, Charlotte. You mentioned that in developing your framework, that it took 2 years. That was very impressive to me, that you took the time to involve, obviously, a number of stakeholders. Could you talk a little bit about how you got people's input? But I'm particularly interested in community residents and the role that they played.
Well, we started out, we really hadn't, when I say we, I'm talking about my colleague Geeta Pradhan and I. She was then the head of Sustainable Boston. And I'll just say within these walls, and John, don't tell anybody, been charged with developing sustainability indicators by her boss at the city, Kathleen Douglas Stone, who was then head of the environment department. And they thought that just by bringing together people within the city, you know, departments, that they would end up with some indicators. But they had such a hard time getting people to share their data that just was a dead end. So I had been working with a number of people, including John and others, probably some in this room, on something called the Boston Children and Families Database. We'll talk a little bit about that later today, but we'd actually been working on that since about 1992, and this was early 97. So Gita came to me to say, help, basically, let's just partner. So we thought, okay, how are we going to start? So we started by convening the groups in the city that were doing comprehensive community building initiatives. In other words, Dudley Street Neighborhood Initiative, Neighborhood of Affordable Housing in East Boston, Common Square Health Center, a number of people, because we thought, or we knew, that they were challenged on the measurement side, that they were doing deep community work, but and their funders were saying, okay, so tell us if it's working, or what are your benchmarks, and we knew that they didn't really have those yet. So we started there, around with literally around a table, and then people started hearing that we were doing it. And I don't even know how. Well, I mean, it turned out the police department was doing some very sophisticated measurement work, and the city's budget office, but also a parents group in the city, or then. So the table started getting bigger and bigger. So pretty soon we had 50 people. Then what we would do is count off, 1, 2, 3, 4, 5. We wouldn't let people break out into their areas of expertise or their own neighborhoods. Just 1, 2, 3, 4, however many small groups. So it was really, we called it a diagonal cut. Eventually we had, HUD and the EPA calling us to say, hey, we heard you're working on indicators, and, we'd say, sort of, y'all come. And so we had a very weird, very diverse group of people, and the group actually grew to be about 300 people over the 2-year period. And not to say that everybody was always in the room counting out to 5 at all, but we had big meetings and little meetings, and at one point I think we had about 1,000 people at an event in one of these hotels, where we had tables, and we had worked with students at MIT to figure out how to use systems thinking in a group. We had done, you probably were there, we did one exercise that was just a total failure, so we had to go back to the drawing board. And anyway, it was a very, whoever was interested, and so we had people from, I can't say that we never did really methodical outreach, because we had seemed to get quite a diverse group of people who were pretty committed, and we couldn't really handle that many more. So, it was coming off the Persistent Poverty Project. I mean, I started to get interested in this because I don't know how many of you remember Nelson Merced. He was the first Latino state legislator, but his wife, Estela Carrion, had said to me, they were both members of the strategy development group of the Persistent Poverty Project, I just hope that whatever else comes out of this project, that we end up with a capacity to track and measure poverty and, really be able to go deep on the data side. And she probably said that in 92, 94 or something. I mean, things take such a long time. We didn't think it would take so long, but so we were building on that work and building on the work that Gita had done, and building on the work we had done with the Boston Children and Families Database, where we had released I'm going to say this later today, but we had worked really hard with a number of people, and we had created something that we called Barefoot Gis, with big pieces of acetate that you walked around and you put them over the big map of, a census map of Boston so you could see the census tracts. You know, first you put it over a big map of the city so you could outline your own area. Then you'd walk over and put it on top of the census tract map so you could see what census tracts fell in it. And then you'd type those in, and then you could get some data out. And we released that at Whittier Street Health Center. Gave out the disks of data, you know, 8 floppy disks when disks were big. I mean, that's how long we've been at this, before there was an internet. I mean, before there was a World Wide Web or, you know, email. I remember people talking to me about email, you know, have you tried that? So it's been a long time. And we've refined, you know, we came out with our first report and we printed a draft in 1999 and made 1,000 copies available and got more feedback. And you know, it took us, when I say 2 years, might even have been 3, you know, of just trying to create the framework and get the data. I mean, at one point we had a wish list of 1,500 items, you know, that everybody had generated, and then we had to figure out, okay, well, what can we actually measure? But that's what had come out through these big processes. I don't know if that really answered your question, but it was sort of a long and broad path.
I'd make one little comment and give you an anecdote on what Charlotte just described. Back there in the early 1990s with the Child and Family Database, it was an information sharing project. Well, now that sounds dangerous, doesn't it? Nonetheless, all agencies that had information, which of course they did not want to share, bureaucracies are by their very nature conservative and secretive, but they were glad enough to see their members or representatives there. They let me go. And so we had to get our agencies, our entities, our bosses to share information. Yeah, they didn't want to share. So what did we do? Well, we went back and we said, the Boston Foundation is doing this very ambitious thing. It's really wonderful, but of course it could be dangerous to us. You know, it's an information sharing project. They want our information, and then they want to share it. And you know, the worst thing of all is, everyone else said yes. They're all going to share. And it looks like we might be the only ones who are not participating. This could really make us look bad. Of course, the response was, well, in that case, since everyone else is going to share, we don't want to stand out as being uncooperative, I guess we'll have to do it too. And you can imagine this conversation going on simultaneously in dozens of locations all at once. Well, I think the statute of limitations has passed on that. The people who might be offended that I had possibly misled them a little bit those many years ago are now gone. And so I share with you that anecdote and say, best of all, be persistent, as Charlotte has been. If you haven't that persistence or patience, be devious. And remember to share. Mom said, it's best to share.
You know, what was interesting in those early years, as John is kind of saying, is the bosses, you know, at the top of these agencies really didn't want to share. But the thing was that we had around the table, this was on the data side, not even before we got into indicators, just trying to figure out, can we create a comprehensive, shareable database of data about children and families. But people from within these various departments came, you know, the police department and the BRA and the school department. Remember Al Lau, everybody, you know, in the basement of the school department? All of these people who really cared about data knew that if they could put their data together with other people's data, it would be so much more valuable. And nobody really had asked for that. And so they all understood how important it was to try to get their bosses to share. And that's the process that John is describing. Other questions? And the other weird thing is that a lot of them had not met each other because they'd all been sort of, you know, squirreled away in within their own departments.
data expertise in the state has just been draining out over the last 2 years. You go to a place, our Department of Education, which is heavily dependent on data, they had 3 retirements and 2 physician eliminations, and they're just sort of really, you got to be a little bit sympathetic, although it's going to take some while to rebuild that.
Hi there. I work in health policy and health advocacy, and I guess probably anyone who works in any policy field has seen their fair share of campaigns launched with very ambitious outcome goals. We're going to eliminate disparities by such and such a year, or we're going to half obesity rates by such and such a year, from the World Health Organization all the way down to local projects, and then little or nothing actually happens. So I wonder, I see a lot of reports where we have a lot of outcomes data. So the end goals that we want to affect, we have very few indicators for the sort of procedural things in the middle that you have to affect to get to the outcomes, but aren't the outcomes themselves. So I suspect the answer is we need both sets of data, but I feel like we have an even greater shortage of those procedural steps, like what you need to do obesity, not the end goal. Thank you.
Thank you. I see George Grinstein and Helen Lyons here from UMass Lowell, and we've been working with them. We say 3 years, but I think it might be 5, or all these things take so long to build the kind of capacity that could actually help us figure that out. Because yes, you end up with outcome measures and maybe a couple of benchmarks, but you can't really see what's going on, or whether, I showed you, and that was on Weave, this Weave platform that George and his students have built. All the schools, all the 3rd grades in Boston. And then, as I mentioned, I didn't show it, we can just quick like this, look at, okay, where, what are the high percentage African American classes, or Latino, or white, or whatever, and it's really interesting, because what you could see is that African American kids are really spread across low and high performing schools. Latino kids are much more concentrated in the low performing schools. So to me, that says maybe there's not enough outreach to those parents about the high performing schools. Some things that would suggest strategies that could be tested. So I think when we have this new tool that you're going to see, and when you start to use it and disaggregate the data and be able to go up and down, to really track it and assess whether something's working, or whether, what is a high leverage point. I mean, again, as I mentioned, I personally think we all need to get healthcare costs down, because we have a highly commercialized, profit-seeking kind of system that's just sucking up all the money for everything else. So we're never going to be able to do those other things, including make people well, if we don't deal with a very fragmented and inefficient healthcare system. So that would be my vote for, but anyway, I think we all need tools, and then George and his students are going to turning Weave into a platform for collaboration. So across sectors, or within a sector, across the world, you'll be able to have people on the same, looking at the same screen, moving things around, talking about what they're seeing, flipping the data. We're trying to build a true platform for analysis, visualization, empowerment, under real critical thinking. So I hope that that'll be part of the solution.
The question reminds me of the debate we're having endlessly at the intersect between indicators and performance measures. So what you're describing could be seen as like, in a particular initiative or intervention, what are the performance measures? Like, how many schools did we hit? How many kids did this? What are the processes? If we know the mechanic of how obesity is reduced, and it's related back to diet and to exercise and specific, it really intersects with program evaluation and performance measures, which I think should be built into these systems as well, so that at the community level they know, if we've decided as a community, because of this high indicator of obesity, that we're going to do a Let's Move program across all schools. Okay, how many kids are actually participating? And then we have the physical fitness tests that are required by the feds, so we know how many are actually getting more fit, at least as measured by those tests. And then
One last question, and then I think it's lunchtime, right?
Yep.
So,
Just one brief demographic caution. For example, you were talking about test scores assessment on the part of African American kids. You may run, I repeat, may run into the probability those kids are not in fact African American, but black kids with
Yeah.
different demographic backgrounds.
Yeah, a good point, and I should have said black. That's a very good corrective, thank you. And because there are, let's say, a lot of newcomer immigrants who,
And multi-generational income.
uh-huh,
In terms, for example, I'm talking now just of raw political data, not demographic stuff you're working at. You can deal with areas of Dorchester where the raw census data indicates you're dealing with African Americans strictly defined as descendants of North American slaves. The people that actually participate politically are predominantly, by predominantly, I mean 80% plus, English-speaking Caribbean by background.
thank you, sir, for, that's a great example of what I was trying, the point I was trying to make is go underneath the headline. So I was, mistaken in having that kind of overbroad headline, and thank you for making that point.
Just in case you're wondering what this is the Connecticut Mastery Test results of goal and above in reading in grade 3 as percent of all students in that towns by town, 169 school districts, towns, and eligibility for free and reduced lunch meals in grade 3, percent of students in that town. And the color is the low birth weight, births under 2,500 grams. And then the size of the dot, the fourth dimension, is the population of that town. So it's, you could say this allows you to sort of like slice and dice, and you can pick and blow up sections, create subsets within this to really examine. But it shows you that, and you can illustrate this in ways that, and analyze it in ways that were a little bit more difficult before.
Well, I thank you all for coming. It's lunchtime, so we don't want to eat into that time. But if you have questions, I'm sure you could grab one of the speakers and talk to them afterwards. Thanks.